Hi, my name is Rade.
Hi, my name is Jackie.
Hi, I'm Mary Moore.
Hi, I'm Dr. Mary Jo Krause.
And I am a psychologist in private practice in Milwaukee, Wisconsin. I have a degree in psychology, a master's degree, and I've been practicing for 40 years, so I have a lot of time and experience behind me.
And I've been a psychotherapist for around 20 years, maybe a little bit longer. I'm in outpatient private practice. I have not always been in outpatient private practice. I've been done a journey of working in residential treatment and also hospital settings, and I've now been the majority of my time in private practice.
I practice in San Antonio, Texas, and I've been in private practice for over 20 years.
I moved to Texas about 15 years ago. After graduating a PhD program, I came to Texas to teach as an adjunct at UTSA. I taught there for about 10 years and was working in an agency, got licensed, and eventually went into private practice. And although teaching is very rewarding with giving back to students, I found my work with clients far more rewarding.
My background is in trauma. That's my specialty. I'm primarily working with people who have experienced trauma and the depression, anxiety, and personality disorder that result from that.
I work with adolescents and families and couples and people with everyday problems, as well as people with trauma. And then I received an advertisement in the mail for the training for AAMH and decided to do another hypnosis training from a different perspective.
I attended the annual conference, an annual conference which introduces hypnosis and medical hypnoanalysis.
I was drawn to this after watching the weekend conference, which had a patient that was treated from the very beginning through the whole course of the treatment. And the trainers are wonderful and friendly and warm and gentle and explain from beginning to end what they're doing and why.
One of the things that I thought was amazing about the conference was that there was a actual treatment, demonstration treatment over 3 days, 9 sessions with a client who went through the assessment process and the age regression therapies.
And the transformation that the gentleman went through, the client, who was an everyday client, just a young man who was an everyday person. It was not a therapist getting therapy as an example of how to do the therapy. It was a regular client, and he was really transformed. It was just beautiful to watch.
I was amazed at what I saw, incredibly impressed, seeing how both stable this person who had a very difficult background, how stable he remained throughout the process, and the amazing change from our first day meeting him and his introduction and the end of just 3 days of treatment. So I said, okay, that sounds marvelous, and signed myself up for the advanced training.
So I started I work with a lot of addictions, and there's a lot of trauma, and I got certified in trauma resolution for rapid resolution therapy for trauma and using hypnosis. And it got fantastic results. People were walking out of my office and having their completely transformed, having the trauma relieved and able to get on and without the worry of relapse.
But this style of hypnoanalysis works at the root cause, which I find to be incredibly helpful.
One of the things that incredibly excites me about this approach of medical hypnoanalysis is I think they've done an amazing job of addressing that very fundamental issue in treating trauma survivors.
Medical hypnoanalysis tends to take it much further and deeper. For those of you that may be familiar with internal family systems therapy or holographic memory resolution, types of therapy. It has a nice deep flavor to it, and I've worked with those modalities both personally and professionally.
This association are quite wonderful in the sense that they were trained by the original Dr. Scott Sr. And so they want to really share this modality with everyone, and it's so infectious in a way because of their passion. You just can't help to feel as though you're part of a family, and they're willing to share because it is really such a wonderful way to help your clients, and it really helps me as a therapist. I learn to relax more and move through material that perhaps I'm working on as well.